Hello, everyone. Welcome to our community conversation. Today, we'll be talking with the Penn Medicine and the City of Lancaster to ask questions about the harmful effects of lead, lead safety, and abatement, and they're available for our lead programs. My name is Cedrick Kazadi. I'm the president of the Millersville NAACP chapter. And today we are joined with two guests. One of them is Mr. Darren Parmer, who's the lead program manager at the Bureau of Lead, Safety, and Community Development for the Lancaster City. And then Ms. Marisol Maldonado, who's the manager, lead positioning prevention program at the LGH Penn Medicine. So I'll go ahead and pass it on to our wonderful guests, and they'll take it on from there.
All right. Thank you so much, Cedric, for the introduction. The City of Lancaster's program, we have a presentation that we would like to share. And just to give you a little bit of background about lead poisoning, lead was banned from the residential use in 1978. So that meant, if Home Depot was selling lead paint in 1978, they banned it from the store shelves so you could no longer use it. Lead is a neurotoxin, and it affects children very negatively in a cognitive way where they have cognitive impairments. Lead poisoning affects 1 in every 6 child in the city of Lancaster. And so we take this very seriously. The administration takes it very seriously. And to have Penn Medicine, join forces with the City of Lancaster is an incredible endeavor and an incredible partnership with Penn Medicine, because now we have the health side coming into, what we're trying to do to reduce lead exposure with children. So our program has been in existence for a few years. Recently, we were awarded $9.7 million to address lead-based paint hazards in city properties. With this particular grant, we have targeted certain neighborhoods in the southeast and the southwest parts of the city. Now, our funding source comes from Housing Urban Development, from the Office of Lead Hazard Control and Healthy Homes, and they have picked out the census tracts that they wanted us to spend the money in. So we applied for the grant, we were awarded, and they said, we want you to work primarily south of King Street. So as King and Queen divide the city, you go up King Street, everything on the south side of King Street, we are targeting. We are tasked with remediating about 710 properties over a 5-year period. So Lancaster County's lead poisoning problem is a lot more extensive than the recent publications of Flint, Michigan. There was a lot of press regarding the Flint, Michigan situation. We have 4 times the lead poisoning cases that Flint, Michigan has. So we have a very serious problem in our city. So one of the reasons why we were targeted for this large grant. So right before we rolled out the program, obviously COVID delayed everybody's programs and initiatives. So we, it took a while for us to get on the ground to start up, doing remediation and inspections and things. We used to have a team of 3, and Marisol used to be with our team, and she shifted gears over to Penn Medicine's program and started up their program. So we were able to hire 2 new risk assessors, some outreach specialists. We have a new enrollment specialist and some clerical staff. So we, again, hired an outreach specialist. We have a social media page. Lead Safe Lancaster. We're also on Facebook. In fact, I think we did a Facebook Live at 5:30 today with our outreach specialist, Daniel Sosa. He does an amazing job spreading awareness and educating our community about the dangers of lead. And really, in order to accomplish the goal that we have set forth ahead of us, it really requires building partnerships. So our partnerships with the Lancaster chapter of the NAACP, for example, is important to help us, be the voice of what we're trying to accomplish. So we appreciate that partnership, and we're constantly out in the community. There's a sign that we have on one of those pictures there. If you see that down in your community, it's telling you that we're doing a lead remediation project in your neighborhood. And so we try to canvass those neighborhoods with outreach workers to spread the word. And a multitude of outreach events that we try to engage in. Here's some of the partnerships that we have established. In no special order, we do go on the soccer radio station, WLCH, pretty regularly. And we have a few bilingual staff members that help us out with that. And here's just a list of some of our community partners. And we couldn't do this without them. Really, it takes a community to raise a child. It takes a community to really accomplish the goal that we're trying to accomplish. So we appreciate all that partnerships. One of our barriers or challenges is because it's a HUD-funded, federally assisted program, there's a lot of HUD paperwork that goes with that. So one of our challenges is getting some of the documentation back on our income status. So, because every program that we administer is an income-based program. So retrieving documentation on someone's income can be challenging. Here's a picture of one of our risk assessors performing risk assessment. You also have one of the devices that we use to actually do a lead paint inspection. So that little handheld device is a metal detector, and it detects lead. And so we go through the property, shoot the property with that XRF machine, and it tells us where lead paint exists. So we take those readings and we take dust wipe samples and we figure out, okay, we have lead paint. Do we have a hazard below that lead paint? That's how we do samples to put together a report and meet with the owners or the landlord to review that and show them where the lead is and what we can actually do to help that situation. During the COVID pandemic, we've had our struggles. There's been building material shortage. We've had a lack of workforce in our community to actually help us work to actually do the remediation work. So a lot of struggles that we've encountered with the pandemic and the results of that. So we're trying to fight through that. We constantly, Marisol and I both are working together to increase our contractor pool. And so we provide trainings and things like that to help, bolster the contractor capacity. So on our social media page, we're on Instagram and Facebook. We like to go back to the customers that we serve. And this is a gentleman that we helped. And again, there's our sign. We put that up when we sign contracts with the owners. And so as the work's being done, you can recognize that sign, and then hopefully that triggers conversation about, oh, what's happening down here. So here's a little bit of our numbers that we have accomplished so far. And as you can see, we have a long way to go with our 710 property commitment with HUD over a 5-year period. we have a lot of work to do. These are a few examples of the workmanship and the safe work practices that our contractors will take to keep, families' properties safe from exposure while they're doing the work. So this is 6 mil plastic, and it's just an example of how they go in and basically blanket the property with plastic so they don't leave any unwanted lead hazards behind. Another example of, looks like they're stabilizing baseboard, so they got some pictures there. And as you can see, all the work stays on plastic. We have this picture in here to show that we have a historic city, so we don't deviate from the historic features of our city. So for example, the picture in the middle is an arch top window, and they're very expensive. That window right there retails at about $1,400. So the point of this is that, we really put in quality material in your homes. And so we're not just throwing in the cheapest vinyl window that we find. We have to follow all the historical guidelines when we do replacement of components. Another example of some things that we've done, there's a new door. That could be a bedroom, bathroom door. We put in solid wood doors. We don't put the hollow core doors in that fall off the hinges after a year. So we really, again, put in quality material. The picture on the left is an example of, we had a family that had a really bad case of asthma where the child was suffering from asthma attacks. And part of that $9.7 million in our program is we also include other healthy homes issues. So we got rid of the old carpet that was creating asthma triggers, and we put in this luxury vinyl plank flooring. Another picture, there's our stop windows. If you look out the window, that is the St. Joseph's Church Cemetery. So that's Poplar Street right there. Just a feature of some of the work that we can do. Okay, so that sort of summarizes our program. And Marisol, I'm going to hand it over to Marisol to do her program overview.
Thanks, Darren. So hi, I'm Marisol Maldonado. I'm the lead poisoning prevention program manager for Penn Medicine, Lancaster General Health. Our program really started and launched August 23rd of this year. So we're super new, but supporting the initiative that Lancaster City has and also addressing lead hazards throughout the county. So really the reason that the Penn Medicine Lancaster General Health decided to launch a lead program was as a result of the 2019 Community Health Needs Assessment. 2019 Community Health Needs Assessment is something that a nonprofit hospital has to do every 3 years. They do a community health needs assessment. That specific one resulted in the community saying, hey, there's a lack of safe, affordable housing. And so LGH board agreed to address the safe component of a home. And so as a result, these are the things that were part of the 2019 results of that assessment. But as you can see there, affordable and quality housing was an issue. And these are the other things that were addressed in that needs assessment. So out of that, out of those results, the board invested $50 million over the course of 10 years to be able to address lead throughout the county. And the reason that we are doing it is because there is no known threshold for harmful effects of lead. So it doesn't matter how much lead there is in a child, it has known harmful effects. And so these are some of the things that a child could experience as a result of lead exposure. The housing that is at risk in Lancaster County. This is just a picture showing, this is all the properties that were built before 1978. And the picture there just illustrates how the brighter colors show, okay, this is the amount of homes that were built before 1980. But properties that were built before 1978, Lancaster County as a whole has over 50% of their properties built before 1978. So it's estimated that over 90,000 properties in Lancaster County have a lead-based paint issue. So these are the 5 components of the Penn Medicine Lancaster General Health's lead program. The program is called Lead-Free Families, and the initiative really encapsulates these 5 main components. So around education and awareness, we want to provide countywide information to residents, to any community agencies, any civic organizations about the dangers of childhood lead poisoning. We want to make sure that our community understands why this is such a big issue in Lancaster County. And we also created a social media page and have a website, leadfreefamilies.org, that provides education. So anyone can go on that website and pull education off around lead hazards. And also we have, our phone number is 544-LED. And so anyone can call us and just ask us for any type of information around lead, and we'll be there to provide that information. So just making sure that our community understands why lead is such a big deal, and how to get your, how to decrease the lead exposures that may be found in your home. So the next component of the program is around screening. So Lancaster has one of the lowest screening rates according to Pennsylvania Department of Health. And so we're working with our own, right? So Penn Medicine, Lancaster General Health, our physicians, to make sure that we are testing children 2 times before the age of 3. And so we are also working with other providers other than outside of Lancaster General Health to have that same screening protocol, so that all primary care physicians in Lancaster County really is doing a universal screening for our Lancaster County children. And so our program also has eligibility requirements. We work closely with the City of Lancaster's program so that when someone calls our either program, that we're going to, the person on the other end wouldn't even know what program they're calling. And that's really, we tried really hard to make that seamless, so that the person doesn't have to, the individual calling doesn't have to know what program they would call for or what program they qualify for. So when they call our program, or when they call the city's program, we're doing a warm handoff, making sure that that person stays on the line, and then we connect. If it's through the phone, we actually connect them before we get off the phone to the city's program, and vice versa. And so the program eligibility requirements are the same. The first 3 are the same as the cities, right? The property has to be located in Lancaster County, built before 78. A child at the age of 6 or younger must live or spend a significant amount of time at the property, or a pregnant mom must live at the home. The 4th bullet point there, our income threshold is 400% of the federal poverty level. So as an example, a family of 4 that makes $106,000 or less would qualify for our program. The city's income level is a little smaller. So for a family of 4, their income level is $66,400. And so what the city and lead-free families agreed was that if the City of Lancaster has 4 census tracts that they're able to focus their funds in. And so what Lancaster General Health with the Lead-Free Families program decided to do was support the city and address all the other homes that are outside of those census tracts. And that's why those warm referrals happen, the warm handoff, is because we understand that the City of Lancaster's lead program can only focus in certain areas. So that's why we decided to partner together. In addition to those components I have explained, we also heard from physicians that there is no case management happening right now throughout Lancaster County. And so when a child was identified with an elevated blood lead level, there was not one specific place that they can call. And so what Lead-Free Families Program does now is a physician, whether in Lancaster General Health practices or outside of Lancaster General Health, any family can access our program, and any physician can also call us to help with that case management. And so what we do around case management is if a child has been found with an elevated blood level, we want to make sure that we are providing the referrals that child's going to need, right? Because we understand that that child is going to be affected permanently. And so sometimes that means that child's going to need learning supports. And so trying to make sure that that family understands what referrals and what other agencies need to come around this family to help them. In addition to that, also making sure that the family is following up with their visits to whatever doctor they go to follow up with that with the lead testing. Outside of the elevated blood level cases, right? So we want this program to be proactive. We don't always want it to be reactive. And that's the same with the city's program. And so proactively, we are trying to, find those families that are testing their child or trying to connect with those families and really coming around that family to explain to them what the Lead-Free Families Program process is. So from beginning to end, our case manager is going to be with that family. So the next component is around remediation. So just like the City of Lancaster's lead program, the Lead-Free Families Program has a contractor that they decided to partner with, that we decided to partner with, to be able to do the remediation. And so the remediation services are provided for free for the owner, occupant of the home. If you have a rental property, or if you're a landlord, you're required to pay 10% of the remediation costs only. And so once the case manager has determined that the family is eligible, there is a lead risk assessment that happens, or a lead inspection that happens in the home. After that inspection, the remediation happens, or we understand what remediation needs to take place. And so when that remediation is about to occur, then we remove the family from that home, pay for the family to be relocated on a temporary basis while the remediation is happening. And so when that remediation takes place, then once that remediation is done, we tell the family when that property is free of lead hazards, and that's when the occupants are able to come back home. The last component of our program is policy advocacy. So Lancaster General Health's Lead-Free Families Program really wants to help any borough or municipality around the county to increase any housing codes to promote safe housing. And so our program has the ability to go throughout the county. While we support Lancaster City's Lead Safe program, we are also out in the county doing the same exact thing. So we want to make sure that lead hazards are eradicated throughout the county. And so that's why our program goes throughout the county. And also because, we understand that Lancaster General Health serves the entire county. And so we are educating whatever local municipalities are interested in any safe housing standards, or if they're interested in creating a specific lead ordinance to address their community. So we want to be there as a resource for them. So that concludes the presentation. for both programs. And I see that there's some questions in the chat. Cedrick, did you want us to go through those questions, or how did you want to handle that?
Yes, thank you so much. So I can read them out for you, and then you can choose who wants to go first in terms of addressing the questions, if that works.
Sure.
So the first question is from Miss Maxine Cook. It says, since lead is so harmful to children, can you explain why these lead removal efforts are restricted by income? And then there's a second part to that question. It says, could you also indicate how homes are prioritized for lead removal?
So I'll take the first and you take the second.
Okay.
So the reason that there's an income restriction on both programs is for the city's program, they're federally funded. That's a federal program that's funding the lead remediation. And so that is their rules. Their rules are that families that are taking advantage of this program, of the city's program, meet the 80% of the area median income. So that's not really something that the city had control over. That is a federal requirement. For lead-free families program, and really the reasons why any lead program will have income restrictions is because we understand that families that are income restricted have the most difficult time, right? Putting money aside to get these type of repairs done to the home. So a typical remediation project is around $12,000 to $13,000 in a typical city row home. So if you can imagine, if someone's just trying to put food on the table, pay their bills, you don't have this slush fund on the side to address these remediation efforts. So that is why there's always restrictions on their income. And nationally, that's what you see, is that there's always an effort to elevate our families that are most vulnerable and most at risk with the income piece.
Absolutely. So to address the priority situation, the biggest priority is, reacting to a lead poison case. So those particular properties would get the first priority if there is an elevated lead level in that property. So obviously they take precedence over any application that we receive. And then based on that, after that, we basically, it's first come, first serve. So, depending on when you get your application in and get it approved, we get the inspection out there within 2 weeks or so or less after we receive notification that the application has been approved. So I know that we talked a lot about our programs, and we talked a lot about, programmatic things and things like that. But just to put it in perspective of why the City of Lancaster and Penn Medicine has taken this effort to our communities. In 2019, we had 94 lead poison cases. That's 94 children. That's just the City of Lancaster. And as Marisol mentioned before, the screening efforts we're one of the worst screening effort as far as getting kids screened for lead poisoning. So imagine if you had 5,000 kids, but you only screened 1,000 children, right? And you had 94 kids that had elevated lead level. What would happen if we did 5,000 screenings? So there isn't universal screening in Pennsylvania, which it's been pushed to pass that legislation along to have universal screening at age 1 and 2. Lancaster County does an awesome job because of Penn Medicine, in my opinion, to encourage doctors and pediatricians to do the testing. But just think if we actually did test 5,000 children, what the numbers would be on that. Furthermore, has anyone ever been to the Farm Show Complex in Harrisburg? This always blows my mind. And the capacity to go into the Farm Show Complex in Harrisburg Arena is about 8,000 to 9,000 people. Every year in the Commonwealth of Pennsylvania, we have we have lead poison kids that would fill the capacity of the Farm Show Complex every year. Let me say that again. The capacity of the farm show, 8,000 people. in the state of Pennsylvania, we could fill that farm show complex up every year with lead poison kids. When I heard that, that was one of the most alarming things I've ever heard. And I just heard that just a few years ago. Real quick, before we go on to the next questions, a lot of studies have been conducted showing that for every dollar we spend to prevent childhood lead poisoning, there's a return or a savings from the Commonwealth of $217. And that is because when you have a lead poisoned child, they need educational support from classroom to classroom, because one of the effects are cognitive impairments, learning disabilities, speech impediments. You know, the average IQ of a person is about a 100 IQ. For every 10 micrograms per deciliter of lead in a child's blood, you would lose about 17 IQ points. This is irreversible damage caused by lead. This is why it's so important to stay ahead of the game and be proactive rather than react to these lead poison cases. So I'll just end it with that and go on to the next questions.
Thank you so much. I guess for some families that might be worried about monetary expenses, are there any monetary expenses that they should prepare for or expect in terms of like when it comes to application or requesting an assessment or anything like that?
No, actually, for both programs, it is completely free to the person that's living in the home, whether you're the owner occupant or whether you're the tenant. It is completely free from the time that you apply to the lead inspection, the remediation, the relocation of the family. All of that is free for both programs. The only time that someone's going to pay something is if you're a landlord of a property. Both programs require that the property owner, if you're renting your property, that the property owner pay 10% of those remediation costs.
Thanks so much. And looking here, I guess some of the questions that were submitted earlier, could you guys give like an estimate of how much has been invested in all of the programs to address this issue, if that's something that you can share?
So you're saying like what's the total amount? So for Penn Medicine, Lancaster General Health has invested $50 million in the lead initiative.
And the City of Lancaster has had previous lead grants before, but this is the largest lead grant that we ever received. We're at 9.7 million, but we're required to match that by 10%. So we're going to end up spending over $11 million in 5 years. But just to add to that, the Commonwealth of Pennsylvania right now, there's about $80 million sitting in Pennsylvania to do lead remediation. Montgomery County, Bucks County, Harrisburg, the city of Reading has just received notification that they're receiving a grant. We have out in Allegheny County, you know, on the west side of Pennsylvania, there's money. So we have a lot of old housing stock. Lead paint was very prevalent back in the day. And now that the properties are starting to deteriorate, we're seeing more and more cases of lead poisoning because the housing stock is starting to need work. You got to maintain the property. So.
Thank you. I have a question, and this is for me specifically. So listening in, and when it comes to like the application process, it's a little bit complex, and it seems like it's a lot of paperwork for a lot of families that are in low income communities. They don't usually, some of them don't know how to read, or some of them don't really necessarily know how to fill out these documents. So is there any program that's being set in place to like help them fill out these applications? And is there like any like emergency response in terms of like, you know, that time that it takes to fill out the paperwork and like send it in before you're even approved for it, that somebody goes in and makes sure that these families are being taken care of?
Yeah, so for our program, for Lancaster General Health, Lead Free Families program, actually, there's just a simple intake or interest form. So you just put in your name, you know, give us your name, phone number, address, and we actually would do the application with you on the phone. So for us, we have someone that has the ability to stay on the phone with you and ask you the questions. So for the application, so that's not a problem. Your second question was those cases or those families that may have like a severe issues. Is that what you were asking? The second question?
Yeah, so my question was in terms of like before, let me say I have a lead issue in my house, and before I even get the assessment, during that period, is there anything that's being done to expedite that process? Because I mean, if I have lead issues, then my family could be getting sick during the time that I'm still waiting for the application. But is there like an emergency response or anything like that?
Yeah, I think both programs do prioritize elevated blood level children, right? So when a child has been identified with an elevated blood level through their physician, those families are prioritized in both programs. We are that's the reason why both programs exist, because we want to get to that home right away so that there's no further lead exposure to that child. So yeah, you call either program, and for us, right, for Lancaster General Health, we have the ability to determine who those cases are, who those families are. And so we actually call them and say, hey, we found this, and let us help you. For the City of Lancaster, because they're not a health system, it's a little different. But also working with the Pennsylvania Department of Health to be able to identify where those lead cases are, so that outreach can happen to those families. But if that family or that physician calls the City of Lancaster for their lead program, the city would prioritize that family as well.
In addition to that, while we're doing the inspection, we are communicating with the tenants or the owners of the building. So as we go through the inspection, we're calling out, where we find lead. So we can talk them through that and say, hey, you might want to do this or do that, so to reduce that exposure. Like once we identify where lead paint is, we don't know what the dust wipe results are from the lab yet, but we know that when we find lead-based paint that's chipping and peeling, we know that we're going to have dangerous dust levels. And just to be real clear about it, it's the dust generating parts and chipping, peeling paint. It's not, I would say 90% of the cases are from dust exposure of moving and friction parts. Now, every now and then you'll have a child that chews on a windowsill, you'll have a child that eats a paint chip, but it's typically diagnosed from a child ingesting lead dust over a period of time.
Sounds good. Thank you so much for that.
I'm sorry, one more thing to add to that, because I was thinking about it when you were talking about it, Marisol. We both have outreach. We both have staff on board that will help those individuals fill out that application. Because that was very important that you brought up, that some of these families may not understand how to fill out an application or might not have time. We both have staff that will go into the home and actually help them fill that application out.
And we also both have the ability to translate it in any language. So whatever language the person is speaking, we have the ability, we have translation services, both programs that we can help. We get someone on the call or even in person to be able to provide that translation service.
Thank you so much for the clarification. Doesn't look like we have any questions. Guess I'll open it up to you both. If you have anything that you'd like to add, anything you'd like to leave for the people.
I would like to leave everyone with, please call us. We don't want this, while it's a serious issue and it is detrimental to a child, we also want the program to be preventative, right? So your child doesn't have to be sick in order to access either program. We would much rather do the lead remediation before anyone is identified with a lead level in the home. So please let your family and friends know that these programs exist And please don't hesitate to call either program, and we'll figure out what program that person would benefit from. And just to let our community know that we're here and that we are wanting to provide this, and it's a free service for the most part. And so why wouldn't you want to do this, you know? And if you have any questions, Cedrick, I believe you have my contact information, so please put that in the chat. But if you don't, or if you forget, for Lancaster General Health, it is 544-LED or 5323. That's our phone number. So please reach out with any questions. And even if you don't need the remediation, but just want more information or education around that, we would certainly provide that. And I know that the city's LED program would do the same.
And just to add to what Marisol said, we're currently introducing a new proposed LED ordinance that would require every rental unit in the city of Lancaster have a LED safe certification every 2 years. Currently, it's only for children that live or visit under the age of 6, but we're looking at changing that, and we're proposing that right now. We're actually, we proposed it to council. And we're looking to, and that's just going to trigger more interest and more awareness and education about this serious issue. And it's a serious issue. I mean, the Commonwealth's looking at all millions of dollars to address lead hazards. So please pick up the phone, contact either one of our programs. Our program's in existence for at least another 3 or 4 years. So we don't want to give the money back to the housing urban development. We would like to spend it in our community where it belongs.
Thank you so much. There's a question that just came in. The question is, are there any resources for families who have children over the age of 6?
So for the Lead-Free Families program, if a child over the age of 6 has been identified as having an elevated blood level, we would still remediate that property for our program. And because the city is not able to do that because of the city's federal rules, the city would call us and say, hey, can you address that property? So the short answer is yes. Please feel free to reach out and we can do that.
Thank you so much. We'll make sure the information gets shared. Again, just want to thank you guys. I believe I'm speaking for the Lancaster branch when we say thank you for the information. A lot of people don't notice how important this is, but I mean, I didn't know much about this, but actually know that there's an initiative out there promoting this free help that a lot of people might not know about. It's really something that the community needs to hear. So I just want to say thank you for coming out and actually sharing this information. And I'm pretty sure the Lancaster branches are really thankful for that again.
Thank you for having me.
Thanks for having us.
Definitely. And thank you to everybody that attended. I believe we'll be concluding that soon. So thank you all for coming and have a good night.